Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students, and that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's Undergraduate Nursing Research and Evidence-Based Practice course. Morgan Boudreaux, Alexis DeVille, Phoebe Henry, Macie Leger, and Jacelyn Semien are joining us to discuss their evidence-based practice project. Before they get started with their discussions, I want to let our listeners know that I have shared a copy of these students' evidence-based practice poster to accompany this episode. You can find this by clicking on the show notes in whatever podcast app you're using. So without further delay, let's turn the show over to Jacelyn to get us started.
Hello, my name is Jacelyn Semien, and on behalf of my group members, we would like to welcome you to our podcast discussing information we have studied and researched in our undergraduate evidence-based practice course. The title of our presentation is Massage, Warmth, and Protection, a New Look at Perineal Care. The members of our group are Macie Leger, Phoebe Henry, Morgan Boudreaux, and Alexis DeVille. We are all undergraduate nursing students at McNeese State University. Our group selected this topic because it is not a very well-known topic that many people know a lot about how this topic comes about or how to prevent it. It is an important topic that many people need to be aware of, especially women, in case this does happen during childbirth. They'll expect it. There are some ways to help prevent perineal tearing and interventions that can be performed, which we will be discussing later on during this podcast.
Thank you for introducing your team and presenting your project titled, Jacelyn. Your group selected a topic that is highly relevant to the experience of childbirth, particularly as it relates to supporting women during vaginal delivery. To help our listeners understand why this issue matters, Jacelyn, can you begin by sharing the problem your group set out to address and why is it important to explore?
Perineal tearing or injury is trauma to the perineum that commonly happens during childbirth. This is when the tissues of the perineum stretch or tear as the baby passes through the birth canal. These injuries are rated by degree, ranging from first degree, meaning it's only tearing through the first muscle layer, or fourth degree, meaning it tore all the way from the vagina to the rectum. This is based on how bad the tear or injury is and how many layers of the skin the tear went through. There are many ways to help prevent perineal tearing from occurring. One way is perineal massages. These help by improving blood flow to the area, allowing the skin to stretch, increasing in elasticity, and reducing muscle tension. This intervention is a great natural technique to help prevent lacerations from happening. The next intervention is proper pushing techniques. This allows for optimal fetal descent, meaning the baby is descending in the right position. It also prevents forceful sudden stretching of the perineal tissues, meaning that it gives time for the perineum to stretch naturally when ready, and it doesn't force the perineum to stretch whenever it's not ready. This topic is super important in the nursing profession because with perineal injuries comes infection, pain, and many more complications that lead to negative outcomes. Making sure nurses know how to prevent this and treat it if the problems do arise are essential components to providing excellent patient-centered care. It's super important that nurses educate their patients on what to expect, meaning signs and symptoms that may arise if an infection does occur, like fever, redness, super intense pain. It's also important as a nurse to educate your patient on how to keep the area clean, how to do proper wound care on the area to prevent infection. It's important for nurses to educate for them to stay on top of their pain meds during this time because it can be super painful, especially if they have fourth-degree tear. The education in general also just relieves the patient of anxiety, fear of the unknown, a panic that they may be experiencing because this can be new for them. So most of them have never experienced this before.
Thank you for explaining those foundational concepts, Jacelyn. Defining the different degrees of perineal tears and highlighting techniques such as perineal massage and proper pushing strategies helps our listeners understand why this area of care is so important, especially for students currently immersed in their obstetrics clinical experiences. With that background in mind, the next step in your project was to develop a focused evidence-based practice question to guide your search. Macie, can you share the EBP question your group created and how did it shape your investigation?
Now that we've established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We crafted our question using the PICO format, which includes the population, intervention, comparison, and the outcome. Our population is women preparing for vaginal delivery. The intervention focuses on performing regular perineal massages during the final weeks of pregnancy, and teaching proper pushing techniques during labor. The comparison is the standard or usual care that does not include these additional interventions, and the outcome measures how effective these strategies are in reducing the incidence and severity of perineal trauma. The evidence-based practice question guiding the study is before vaginal delivery, how effective is performing perineal massages and using proper pushing techniques compared to usual care in reducing perineal trauma? By exploring these evidence-based interventions, the goal is to help nurses apply preventative techniques that support safer deliveries, enhance maternal comfort, and promote faster postpartum healing for our new mothers.
Thanks for sharing your group's PICO question with our listeners, Macie. This question served to focus your group's investigations into the literature. Can you tell us more about how you used the PICO question to help you find published research studies about your selected topic?
We used our group's PICO question to create keywords to search the following university library databases: CINAHL Complete, Medline, Science Direct, Ovid, and PubMed. Some of the keywords that we used for our search included risk of perineal tears, proper pushing techniques, perineal massage and vaginal delivery, perineal trauma and childbirth, vaginal delivery, and manual perineal protection. We set specific search limiters on our searches, including full text. It had to be a quantitative study. It had to be a scholarly article. The article had to be published between 2020 and 2025, and it had to be peer-reviewed. I will say that a struggle that my group had was trying to find articles that were appropriate for our literature search and for our project. But our group communicated well, and we worked together to find what we needed. If our group were to conduct this search again, we would study how to break apart articles and the components that make up an article before proceeding with this literature search.
Thanks for sharing those insights about your search process, Phoebe. It sounds like your group navigated some real challenges in locating relevant articles, but your teamwork and communication made a meaningful difference. Now that the literature has been gathered and reviewed, let's take a closer look at what the evidence actually showed. Alexis, can you walk us through the key findings your group identified?
After completing our critical appraisals and compiling the results into our synthesis table, our group analyzed the combined evidence to determine how perineal massage and pushing techniques influence perineal outcomes during childbirth. The collective data provided a clear and consistent message. Evidence-based, woman-centered strategies can substantially reduce perineal trauma while promoting a safer and more positive birth experience. Let's start with what the studies revealed about intrapartum perineal massage. Across several randomized controlled trials, women who received gentle massage of the perineum during the second stage of labor experienced fewer spontaneous tears, less postpartum discomfort, and a shorter duration of pushing compared to those who received hands-on care. The likely mechanism involves gradual stretching of the tissue and increased circulation, which enhances elasticity and tolerance to distension. This intervention stands out for being both simple and non-invasive, yet highly effective in protecting perineal integrity. Next, the evidence highlights the importance of prenatal preparation. Studies examining antenatal perineal massage and pelvic floor training demonstrated that conditioning the perineal tissues before labor strengthens muscle tone and improves postpartum healing. Women who engaged in these exercises had greater resilience to stretching during birth and required fewer sutures afterward. When this early conditioning was paired with intrapartum massage, the protective effect was even stronger, suggesting that preparation before labor amplifies the benefits during delivery. We also identified strong evidence regarding pushing techniques. Research comparing directed versus spontaneous pushing showed that allowing mothers to push according to their natural urges without rigid counting or commands resulted in lower rates of episiotomy, improved comfort, and comparable or lower laceration rates. The evidence supports that physiologic women-led pushing allows for controlled descent of the fetal head, which minimizes stress on the perineum and improves overall satisfaction with the birthing process. When these findings were combined with studies on low intervention woman-centered care, a pattern emerged. Birth practices emphasizing undirected pushing, supportive perineal care, and warm compresses were associated with reduced rates of episiotomy and fewer severe obstetric anal sphincter injuries. The evidence points to the value of individualized care that respects maternal autonomy and focuses on protection rather than control. Finally, when looking across all the research together, the message is remarkably unified. Whether applied antenatally or intrapartum, perineal massage alone or with warm compresses consistently leads to less perineal pain, fewer tears, and a reduced need for surgical repair. These interventions are low cost, easily implemented, and carry minimal risk, making them highly practical for nursing practice and childbirth education. In synthesis, the collective evidence supports a continuum of perineal protection. Preparation during pregnancy through perineal conditioning and pelvic floor exercises, gentle supportive techniques during labor that prioritize tissue relaxation, and encouraging physiologic mother-guided pushing rather than routine manual control. Together, these approaches promote optimal perineal outcomes while reinforcing a woman-centered model of care. In summary, our key evidence demonstrates that nurses and providers play a pivotal role in preventing perineal trauma through education, encouragement, and evidence-based support during childbirth. The findings from our synthesis clearly show that thoughtful, proactive perineal care not only reduces injury, but also enhances comfort, confidence, and overall satisfaction with the birthing experience.
Thank you for outlining those important findings, Alexis. The evidence you shared highlights several practical strategies, such as intrapartum perineal massage, prenatal pelvic floor training, and allowing women to push in response to their own physiologic urges. And these things may reduce perineal trauma and support a safer, more comfortable birthing experience. These approaches are simple, low risk, and they align well with patient-centered maternity care. With those findings in mind, it's important to consider what they mean for nurses at the bedside. Macie, can you tell us about the nursing practice implications your group identified?
Based on the information our group reviewed, we noticed several synthesized implications for nursing practice. The findings from this evidence-based project emphasize the essential role nurses play in promoting safe childbirth and preventing perineal trauma. Research consistently shows that proactive education and consistent evidence-based interventions can make a meaningful difference in maternal outcomes. One important implication is to incorporate prenatal education on perineal massage and pelvic floor muscle training exercises into routine prenatal visits. By teaching these techniques early in pregnancy, nurses empower women to take an active role in preparing their bodies for birth. This supports greater flexibility of perineal tissues, improves muscle control, and promotes a smoother postpartum recovery. These strategies are especially useful in obstetric, midwifery, and women's health settings where prenatal teaching and preparation for delivery are central to nursing care. Another key implication is to standardize staff training with consistent evidence-based protocols for perineal support, pushing guidance, and massage techniques. This can be applied across labor and delivery units to ensure every birthing person receives the same high-quality, researched, informed care. Lastly, the nurses should promote perineal protection techniques during labor, such as applying warm compresses and performing gentle perineal massage. These interventions can reduce the risk and severity of perineal trauma, leading to less pain, faster healing, and greater maternal satisfaction.
Okay, Macie, thank you for highlighting those practice considerations. Your emphasis on proactive education, both for expectant moms and for the clinical staff who support them, underscores how much nurses can influence maternal outcomes through teaching and consistent use of evidence-informed techniques. Ensuring that women feel empowered and that staff are equipped with standardized approaches is essential to protecting the perineum during childbirth. Beyond the current practice, your implications also point to areas where more studies may be needed. So, Phoebe, now can you share with the audience the research implications your group identified?
There's still some knowledge gaps remaining in the published literature surrounding our topic. Therefore, our group did develop some implications for future research. First, there needs to be more research done on more women to get a better understanding on the effectiveness of perineal massage and warm compress. The more research that is done, the more reliable the interventions will be. Second, we need to compare the strengths and weaknesses of the research findings, like the effectiveness of the interventions used. Identifying what to do and what not to do makes lacerations less likely to occur. If the medical professionals were to have to just do trial and error, then the patient's more likely to have lacerations because they don't know what works. Finally, make sure that everyone is well trained and there are protocols in place for the medical professionals conducting the research. Because if this research is not done properly, data may be biased, the data may be skewed, or the data may be inaccurate.
Phoebe, your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of the research studies your group reviewed, including considerations for study weaknesses and continued gaps in the present literature, what was your group's overall literature-based answer to the original PICO question you shared with us earlier?
To sum everything up, after researching many studies, we were able to determine as a group that perineal massage and proper pushing techniques really work hand in hand to help reduce perineal trauma during childbirth. Perineal massage, when started during pregnancy, gently stretches and softens the skin and muscles around the birth canal. This helps those become more flexible and better prepared for the stretching that happens during delivery. By doing this ahead of time, the perineum is more likely to stretch instead of tear when the baby's head begins to crown. For many women, this can mean fewer stitches, less pain, and a much smoother recovery after birth. Proper pushing techniques during labor are just as important. Instead of holding your breath and pushing forcefully, using controlled, gentle, and well-timed pushes allows the perineum to stretch gradually. Following the body's natural urge to push and listening to guidance from healthcare workers can prevent too much pressure from building up all at once. Techniques like breathing through contractions, changing positions, and taking short breaks between pushes can all help protect the perineal tissues from unnecessary strain, which causes trauma. When women practice both perineal massage before birth and mindful pushing during labor, they give their bodies the best chance to deliver safely while minimizing injury. These approaches don't just prevent tearing, they also promote confidence, comfort, and empowerment during the birthing process. Recovery afterwards tends to be faster with less soreness and discomfort, allowing new mothers to focus more on bonding with their babies. Overall, taking the time to prepare the perineum and learning how to push effectively are simple, evidence-based steps that support more positive childbirth experience. It's about working with the body, not against it, and trusting the natural process while using a few practical techniques to make birth safer and gentler for both mom and baby. The biggest thing we learned with this topic is prevention is key, and to make sure to provide education to every woman that is going to go through labor. By doing this, it helps promote patient advocacy and helps really build trust with these patients, which will help us become better nurses in the future.
Thank you for summarizing your group's work so clearly, Morgan. Your conclusion highlights a central theme that emerged from the evidence. When perineal massage and physiologic pushing techniques are used together, they can meaningfully reduce the risk of perineal trauma during delivery. As you noted, these strategies rely on working with the body's natural processes rather than forcing resistive patterns, and that principle aligns beautifully with safe patient-centered obstetric care. I appreciate also how your group recognized the importance of prevention and advocacy. Ensuring that women receive education early, understand their options, and feel supported during labor is a vital part of nursing practice. These are lessons that will serve each of you well as you continue in your OB clinical experiences and eventually transition into your roles as registered nurses. And to our listeners, thank you for joining us in this discussion. Supporting mothers through childbirth is both a privilege and a responsibility, and integrating research into practice allows us to provide safer, more informed care.